I'm Dr. Cooper Williams. I'm here at the Jekyll Center in Thompson Station, Tennessee, and I'm here to present the pelvic ultrasound of the horse, both inside and out. Now we're moving back to the caudal aspect of the horse again. And remember when we went over the horse and the landmarks earlier, we showed that the horse was quite asymmetric between the tuberischial regions of each side. You can see this has a normal prominent profile to it, and this side is smashed or crushed inward, probably from a long injury long ago. Apparently this horse hasn't had anything recently that happened. But here on your specimen, you can see that you're going to be looking again at the tuberischium here. In this orientation, I'll do each side first. So we'll get the normal side first, and then we'll show the abnormal side. So don't stand directly behind the horse when you're pouring alcohol on it. You're just going to simply, we'll flip that image over to the right, so we have right on the right. And all you're looking for is a normal ski slope of bone like that. Your hamstring muscles are coming up to attach to the ventral aspect of that. That's a nice normal image. We're going to flip that, unfreeze, come back over here again, and you're going to see why this side has a whole different shape. So right in the same spot, you can see that it's flattened, crushed, so he most likely either ran backwards into something or sat down very heavily on his rear end, and it smashed one side to be a whole different shape. Sometimes it can happen from a kick. We'll go ahead and sweep that side. You can see that if we go a little bit more toward the midline, that it changes shape even further. You have quite a prominent sharp edge. Here you can see a nice rounded top to this portion of the tuberischium, and this side has quite a sharp edge to it. They should be perfectly symmetrical, and they're not. And then coming back again to the specimen, I'm looking at my image like this, coming out here where the muscle would be. You're looking at this, and you can see how it slopes like this, and that's why it's sloped like this on your ultrasound image here. So now I'm going to reorient my transducer to transsectional and image these from this orientation. And we'll start with the normal side again. And what we're going to do is get this nice, we're coming up underneath that pyramid. And that's just this shape right in here. We'll flip to the other side. And again, you can see that number one, you're not getting as long a portion of this. You actually have a short and flattened portion. It's not curved all the way across like you should. The final thing I'm going to do to look to see if there's any possible avulsion that occurred from this is we'll come back to the right side, and I'm going to scan from the tuberischium to just a little bit below and look at the hamstring muscle, and I'm going to look for any bony fragmentation that might be visible on that abnormal side over here. So again, we'll get that nice transsectional image looking up underneath that curve, and then we're going to move down to the muscle just below. So we're off of the bone. And this is a really good way to be able to look at hamstring muscle for any areas of fibrotic myopathy as well. We'll flip that image to the other side, and I'm going to douse with a little more alcohol. Things tend to dry out fairly quickly. Nobody. And so we'll look at that edge, and again you can see it's nowhere near as long as it was on the other side. As you drop down, you can see that there's still a little fragment of bone within the muscle here. So you do have a little bit of an avulsion of bone from its parent bone that would be from this ventral edge right here. And that completes the caudal aspect of the scan. The final area of evaluation is going to be the dorsal sacral ligament region over the tuber sacrale. So our probe position will be here. We will do bilateral images right and left, and then we will do one down the middle. Moving back over here to our specimen, again, tuber sacrale here, and then the dorsal sacral region here, the dorsal spinous processes. The dorsal sacral ligament, which has a funicular or rope-like portion, goes from here to this dorsal aspect of the sacrum along the dorsal spinous processes, and it does it from each side. From the cranial aspect, you have the thoracolumbar fascia from the back muscles, comes back here and inserts in the cranial region of the tuber sacrale. So we'll move back over here to our patient. I think I'll douse liberally again, make sure that we get a good image. We have a split screen so that we can evaluate this. I'm going to do this in a transsectional way first. You want to be parallel with the floor so that you're getting real-time height of the tuber sacrale. So we'll move in here. We'll come in here just as the thoracolumbar fascia is entering the picture. We'll do the left one here on the left, freeze our image, flip over to the other side, unfreeze, and we'll do the other side. So you can see right off the bat that we have the tuber sacrale is higher, which we know visibly it is, but it's not due to the dorsal sacral ligaments. So you have the dorsal sacral ligaments are this portion on the top of the tuber sacrale here, and the thoracolumbar fascia, I'll use the arrow instead, is this portion. This is the border between the dorsal sacral ligament and the thoracolumbar fascia, which goes from here to here. And then on the right side, again, dorsal sacral ligament and thoracolumbar fascia. So we can do that same area moving back across the top of the tuber sacrale so that we have a broader area to evaluate. And then off the caudal edge, it'll be mainly dorsal sacral ligament. You will have shape variations in this region of the tuber sacrale, and that's because you have separate centers of ossification oftentimes with these portions, and that is within normal limits. So we'll again move back to a little bit further caudally on the left one. And here again, you can see that little variation in shape at the top. The only thing that I see is there's a height difference between the two, and everything else is within normal limits. You can also do these same images looking at them in longitudinal aspect and seeing those ligaments come in, and the thoracolumbar fascia and the dorsal sacral ligaments here in longitudinal. We'll flip to the other side and do the same thing over there. And again, nice normal ligaments, tendon coming back. At the caudal aspect of the tuber sacrale on the right side, you can see the backside edge of this, and I have the probe angled just a little bit so we can see the dorsal sacral ligament as it goes in toward the dorsal spinous process of the sacrum. We'll flip that over and do a dual image from the other side, and again look at that caudal aspect of the bone right in here, and again you can see that slight irregularity of the bone surface right here. Again, that's within normal limits. Those areas will separately ossify in a lot of situations. So, and here you go again. So these are all within normal limits, but that's just a quick review of the thoracolumbar fascia and the dorsal sacral ligament, the funicular portion, as they cross over the tuber sacrale. Slide number 1 demonstrates the external pelvic anatomy from the caudal aspect. TI is the tuber ischium. You can see the paired tuber ischii here, the lower part of this anatomical specimen. Slide number 2 demonstrates this external pelvic anatomy from the dorsal aspect. TI again is the tuber ischium, and also from the lateral aspect. Slide number 3 again shows anatomical images of the tuber ischium, one from the caudal aspect, which is the right-hand image, and one from the lateral aspect, The right-hand side of this left-hand image is the tuber ischium from the lateral aspect. There are normal reference images on the ultrasound images demonstrated below. The left-hand image shows the bulk of the longitudinal aspect of the tuber ischium. The normal reference is on the left-hand side, and you can see fractures. Again, just demonstrating the lack of continuity of the normal contiguous bone line. The central image demonstrates a cross-sectional image of the tuber ischium from the distal aspect. You can see the normal reference part is on the right-hand side of this image, and a fracture demonstrating bone penetration of the beam through the fracture site. The very right-hand ultrasound image, again, shows the cross-sectional view of the tuber ischium, mainly from the proximal aspect. You can see the normal reference image on the left-hand side of that particular image, and again, the lack of continuity showing fracture fragments and the penetration of the ultrasound beam through these fracture segments. Slide number 4 is a slide that shows a drawing of the anatomical structures of the dorsal ilium wing, the tuber sacrale with the funicular portion of the dorsal sacral ligaments. Slide number 5 shows several ultrasound images. The upper hand images demonstrate on the left-hand side the normal tuber sacrale with the attachment point of the thoracolumbar fascia and the dorsal sacroiliac ligaments, the funicular portion. The right-hand upper image shows a core lesion with a small fragment of bone in the center of that core lesion. The central ultrasound images demonstrate again normal reference images and the variation of the appearance of these attachments of the thoracolumbar fascia and the dorsal sacroiliac ligament. On the left-hand side is the cross-sectional version, and on the right-hand side are the longitudinal versions in the direction of the ligaments as they come in to attach and as they continue on. The bottom hand images demonstrate pathology of the dorsal part of the tuber sacrale, which can actually have variation with impartial calcification in some residual portions of cartilage, so this should not be overjudged. But you can see fairly normal dorsal sacroiliac ligaments and the thoracolumbar fascia attachments. Slide number 6 demonstrates reference images on the right-hand side of normal thoracolumbar fascia and dorsal sacral ligaments. The left-hand portion demonstrates significant enlargement of the thoracolumbar fascia and significant tuber sacrale asymmetry. Externally, this horse actually appeared to have normal elevations of the two tuber sacrale because of the thickening of the thoracolumbar fascia. The actual dorsal sacroiliac ligament is slightly enlarged as well.